today on the challenges of fostering tobacco harm reduction strategies in low and middle income countries. And I'll be talking to you from our perspective as providers of addiction recovery services in Lilongwe, Malawi, but also from the data that we have from other low and middle income countries. Yeah, so my talk will basically be around these 5 challenges that we faced as we try to assist people who'd like to cease smoking, but also other substances that people are addicted to. So there is limited research on nicotine as well as tobacco harm reduction strategy in low and middle income countries, but also limited capacity and resources that we have in our healthcare system, as well as other support services that support health delivery systems. There is also insufficient tobacco control measures, and we've also seen that beliefs as well as perceptions have contributed to challenges in adopting these strategies. And lastly, I will briefly also talk about competing health priorities. So as previous speakers have alluded to specifically in the first session, where Chimwemwe was talking about other issues in low and middle income countries, what we mostly see is that there is lack of evidence on THR strategies in low and middle income countries, including Malawi. And also we're not very sure or aware of what would work in low and middle income countries in relation to the tobacco harm reduction strategies. So this all poses difficulties to go further into designing or adapting strategies that have worked elsewhere. And also, we know that sometimes people would report out to hospitals with problems with smoking. They would want to stop, and maybe they are not offered appropriate help that would support them through this process. And we also do not have up-to-date data on prevalence of smoking, as well as a central system that collects data regarding this problem. And similarly, as I said earlier on, limited capacity and resources, this poses a challenge as far as awareness creation is concerned. So a lot of people are not aware of specific dangers of smoking, but also what alternatives are there that would assist people who are willing to stop smoking, and also other methods that people can use. But what we've also seen is that there are very limited THRs available in most low and middle income countries, including Malawi. As I'm talking where I'm working, we only have access to 2 types of THRs. These are nicotine patches and nicotine gum. These are also available in few pharmacies in our country, for example, here in Lilongwe, but then they are quite expensive. And when you look at the income that people have, there are very few people who can afford to use those products. There are also inadequate addiction recovery services that would support people who are willing to stop smoking. The other challenge that we've seen is insufficient tobacco control measures. So as my colleague has said in the first session, there are no comprehensive tobacco control strategies that are put in place to monitor the sales of tobacco. So the sales in relation to the pricing, but also in relation to age restrictions. We've also seen that there are other strategies that are put in place, for example, ban of public smoking, but these are not reinforced most of the times, and also there are no alternatives. So you would rarely find smoking zones, no smoking zones that are provided in public facilities or in public buildings. And also the issue of banning tobacco advertising, and it's not really reinforced. The other challenge that we see is beliefs and perceptions. Tobacco smoking is culturally accepted in some cultures where smoking or sniffing tobacco is used in some of the traditional ceremonies. For example, in Malawi, in the Ngoni culture, when they are conducting traditional marriages, the night that people go to deliver a bride to the groom's home, they would carry with them tobacco that the groom's parents or family sniff. So, like a group of people would be involved in that kind of practice. But also, I think because of such kind of belief and lack of knowledge and awareness, it will be very difficult for people to accept the new measures that are put out there that can control tobacco smoking. And then lastly, we also have competing health priorities. As we are aware, a lot of low and middle income countries have a lot of health challenges against the low allocation of health budgets. So because of that, it is very difficult to prioritize issues of tobacco harm reduction strategies. Focus is mainly on communicable diseases and some of non-communicable diseases, which are perceived to be more harmful to people. So these are some of the challenges that I wanted to highlight. Thank you so much for listening. And before I leave the stage, I think having looked at all those challenges, this is my take-home message to us in low and middle-income countries, so government departments, community members, and all participants who are participating in this activity today, that I think it's very important that governments should make THR products affordable. THR products affordable, but they should also be available in most of the places. As I said earlier on, it is very rare that we find these products in our pharmacies as well as in the hospitals. But also these products should be made in a way that they are socially acceptable. It is difficult to convince people to adopt new measures. Hence, there needs to be some innovative ways of making these products socially acceptable, but also making them more appealing, as well as increasing and improving scientific assessment. We need a lot of research in various institutions so that we should have our own data in low and middle income countries to what strategies would address our specific problems. Thank you.